So the next speaker is Mr. Jose Antonio Vargas. I would like to thank him for participating in our symposium again. He was a speaker 2 years ago and really created a stir. And so Jose is the founder and key strategic consultant of Define American. And the title of his lecture today is The Cost of Telling Your Story. So Jose, take it away.
Hi, I hope everybody, can you hear me okay?
Yes.
Great, awesome. And I have some slides that I'd like to share if possible. Can you see that? Yeah.
Yes.
Okay, let me, awesome. Okay, so it's really a privilege to be with all of you today and to be a part of this symposium. The first time I was invited to this event, actually, I remember telling Barbara Picower, who's been one of the earliest supporters of Define American, that being a part of this symposium was the first time I'd ever been invited to a gathering that asked me to discuss emotional stress and the mental health associated with migration. And I was really thankful for that. And I'm speaking to you actually from Berkeley here in the San Francisco Bay Area. Last year, you might have heard about this. We were actually the first region in the country to ask residents to shelter in place. And we were told that we couldn't go, we couldn't do certain things and couldn't go to certain places, that our lives collectively had limitations. And I remember thinking, this sounds kind of familiar. I remember, welcome to the undocumented life, right? Where you have certain limitations about what you can and cannot do and where you can and cannot go. And I remember actually reading this essay in the Wall Street Journal. I'll never forget. This is one of my favorite writers, Susan Orlean, wrote this essay that said, the headline was, "Never Taking Travel for Granted Again." The subheadline, crossing the globe had never been easier until the coronavirus reminded us of the real meaning of distance. I know Susan Orlean, and I was going to try to reach out to her and say, let me tell you about the real meaning of distance. It's actually more than just not being able to travel because of the pandemic. Because I remember thinking, I've been socially distancing for decades. Millions of immigrants have. Yesterday, was Mother's Day. It's usually a really difficult day for me and many other people because in some ways I've been socially distancing from my mother for 28 years because of our broken immigration system. Because of our outdated and complex and broken immigration system, I have not been able to see her physically since she sent me to America to live with her parents in 1993. She has not been able to come here to visit me. She's been legally waiting in line to actually, for almost 20 years. And she's been denied to come even on a tourist visa, right? Now, I'm a writer, I'm a grown man. I just turned 40. And I'm no longer the 12-year-old young boy that she sent and said goodbye to at the airport. But I'm going to tell you that as a 40-year-old writer, I don't really have the words to fully describe the cost of that physical, emotional, and traumatic separation. The first time I actually gave words to that separation was 10 years ago this month. I can't believe this essay is almost 10 years old. And this is when Define American was born. We all know, we all know that there's a great power in telling a story. When I came out as Undocumented in 2011 and founded Define American, it was grounded in that idea that one story, that one personal narrative could have impact on the national immigration narrative. But what's even more true is that collective storytelling, stories of immigrants from all backgrounds, complicating our idea of what and who an immigrant is even more important and impactful. We at Define American have actually encouraged undocumented immigrants, their families, their allies to come out publicly with their stories. A year after I publicly declared my undocumented status in the New York Times, I asked 32 other undocumented immigrants to join me in this cover story for Time magazine. We have an undocumented Nigerian woman named Tolu, an undocumented Korean named Tony, right? And this was really the first time that undocumented people had publicly, in a major way, participated in a cover story for a magazine. This essay was actually published about a week before then President Obama announced DACA, the introduction of the Deferred Action for Childhood Arrivals. Now, we have seen that personal stories directly affect public opinion and policies. But at Define American, we felt that it is also essential to understand the mental health impact of using one's personal stories for public advocacy around immigration. Now, we all know that we're living in a pivotal moment for immigration, one where there's once again momentum in Congress and momentum within the Biden administration to make progress on immigration reform in the US. But we are still facing the same bipartisan hurdles as prior moments in this movement. We've made so much progress, but somehow, from my conversations with immigrants across the country during this pandemic, somehow it feels like we're kind of back in the same place. For over a decade now, leaders in the immigrant rights movement have used their personal stories to transform public opinion and policy. Their relationship to storytelling has profoundly shaped who we are as human beings. Most came out very publicly before the age of 30. As we move into this next decade of the movement, how can we learn from what we've been through to recalibrate and ensure our people are feeling as strong as our collective movement? So to explore this further, National Geographic actually funded a research study. At Define American, we're really big on research. They funded this research study led by Director of Research Sarah Lowe in conjunction with researchers at the University of Massachusetts Amherst School of Public Health. The research consists of a mental health and wellness survey on PTSD, stress, depression, self-esteem, social support, belonging, and resilience. I love that. These were actually conducted as life history interviews, and it included a digital storytelling workshop. Now, 39 participants are included in the study. Actually, most of the people who participated in this cover story for Time Magazine, all self-identifying as part of the original Dreamer movement, ages 25 to 40, right, who shared their stories before DACA became public. And today, I'm actually going to give you a brief preview of a few findings from this report that will be coming out this summer from Define American. We saw two guiding themes. One, does sharing our story, does sharing our pain free us? And how do we remain resilient? Now, coming out brings about liberation, empowerment, profound community support, opportunities, and sweet victories, such as they are. And it also marked bouts of fear, targeting, and loss. That's the short-term view, and most of us are fairly aware of that dichotomy. But what does the long-term impact look like, right? Most of us are struggling with considerable PTSD. Approximately 80% reported high levels of PTSD. That was a really shocking finding. We, of course, know how traumatizing the past 4 years have been to immigrants in this country, on top of what we were already living with. It's still really hard to see our friends and families, suffering this much. But the next finding from this research also shocked us. 98% are highly resilient. Now, we begin to see the picture of what it is to use our stories for advocacy. Right? Again, the sharing our story, the sharing our pain free us, and how do we remain resilient? We must acknowledge that living undocumented causes a real and present burden to our mental health, and the work of activism also takes a toll. In a life history interview, one of the participants of the survey actually said to us that he characterized being undocumented in this way. It is such a force, like 1,000 raging bulls just charging you. This is what it means to be undocumented and to be public about being undocumented. Now, we know that. We see that in the media, and we see that reality in the media and in our daily lives. But what lays the foundation for resilience for the next 10 years and beyond? That's a really important question. What lays the foundation for resilience for the next 10 years and beyond? We'll be covering that actually in the findings of our next report that's coming out next month. So please, if you don't already follow us on social media, check us out on Twitter, Instagram, and Facebook, and sign up on defineamerican.com/join, because we're actually going to be sharing the first, giving you a first look of our research when you sign up. A couple of last things I kind of want to share. After President Biden was elected, I responded to this Instagram message that I got. I got this message in October, a few weeks after the presidential election. I'm just going to read it out loud. We met. I had a book that was published, and she went to one of the book events. And she says here, I came to the US at the age of 9. I'm turning 19 soon. I'm going through a hard time and I keep returning to your book, but I can't understand what you draw your strength from. I'm losing hope and optimism every single day. I've been diagnosed with severe depression and anxiety, and I have not gone through half the obstacles you have, nor do I think I will. The last lines here really got me. Why keep going, Jose? What is this fight leading up to? I took a long time to respond to her. I mean, I get a lot of messages, but not quite as sharp as this in terms of the questioning. And I didn't really know what to tell her. I didn't know how to answer this question of why keep going. And then after Biden and Kamala Harris were elected, I gave her my cell number on Instagram, and then we spoke on the phone. And part of that was like, I felt like it gave me an opportunity to say, this is why we got to keep going, because change is actually possible. And then what I ended up doing is actually quoting this woman. I'm going to stop sharing my screen here. Hold on a second. How do I do that? Stop share. I don't know if you can see this woman behind me. That's Toni Morrison. She's one of my favorite writers. She wrote a book called The Bluest Eye that had a deep impact on me when I was in 8th grade. And really when I found out that I was here illegally when I was a freshman in high school. Morrison taught me that I didn't need to survive. I didn't need to surrender to this master narrative of America to survive. That an undocumented gay Filipino can create my own narrative so I can survive in this country. So I told this young woman who wrote me this Instagram message, I quoted Morrison to her. There's this great interview that Toni Morrison gave in Connecticut. She was asked, how do you survive in a world where we're all the victims of something? How do you survive in a world where we are all victims of something? I'm going to share the response to you because I don't know how you all have been dealing during this pandemic, but I think this response was appropriate for this 19-year-old undocumented woman, and it's appropriate now. Toni Morrison said, sometimes you don't survive whole, you just survive. But the grandeur of life is that attempt. It's not about the solution. It is about you being as fearless as one can and behaving as beautifully as one can under completely impossible circumstances. Good, Morrison said, is just more interesting, more complex, more demanding. Evil is silly. It may be horrible, but it's at the same time, it's not a compelling idea. It's predictable. It needs a tuxedo. It needs a headline. It needs blood. It needs fingernails. It needs all that costume in order to get anybody's attention. But the opposite, which is survival, blossoming, endurance. I love endurance. All those things are just more compelling intellectually, if not spiritually, and they certainly are. We are already born. We are going to die. So you have to do something interesting that you respect in between. So I told this young woman, right, that thing that she's doing, that survival instinct, right? The fact that she's going to endure, the fact that she's surrounding herself with mentors, because I talked to her and she has mentors, that attempt to create a life for herself in this country under completely impossible circumstances, like that is the beauty of life. And to me, it's also what the cost of what happens when you tell your story, which is something that, as I mentioned, is we're very, very much interested in studying at Divine American. And I'm just glad that we're actually in a position where we can actually do this kind of research, right? Which is not only provocative, but I would argue also necessary to be able to keep doing this work. Thank you for having me here.
I'm going to step in for one question, and intuitively, I know that the young people that you work with who are in the same situation as you, as being undocumented, how do you see manifestations of what they're feeling? I can't imagine what it's like. And I know you've talked to me about what you felt over the years, but do you see there's a let up, or are there more and more children that are suffering from the stress that they're under and their parents are under?
I think what we're actually seeing, that's a great question, Barbara. I think what we're actually seeing is cross-generational trauma. I think what we're seeing is a lot of the younger people have the means to express. This is why I think social media, even though, look, social media is very complicated. As somebody who has a lot of nieces and nephews who are teenagers in early 20s, I'm kind of seeing a lot of the positive and the negatives. But I'm really curious with how within marginalized communities, social media at the very least provides some sort of avenue for self-expression that otherwise doesn't exist. What I'm actually seeing happen is a lot of the young, and when I say young, I mean students in college, early 20s who have entered the workforce, is that they're finally coming out with language to express how they're feeling. And in some ways, they're the ones talking to their parents around the need to actually name what they're feeling and not to just bottle everything up. I have to say that I find this most pronounced among AAPI immigrant families, right? Because a lot of Latinx immigrants, for the most part, there has been language around this. There's a media ecosystem, Univision, Telemundo, in which immigration is actually discussed very openly, right? But among undocumented and just immigrant Asian families, Korean, Chinese, Filipino, I find that there's a lot more denial, right, around their undocumented status. And so many families live, as you know, Barbara, in mixed status families, right, where the kids have DACA, the parents may be undocumented, but other relatives have green cards or other relatives have some sort of status. So what we're finding is young people have the language to talk about it, and they're the ones that are serving as, in many ways, a bridge to their parents and to relatives. What I'm curious, though, is what kind of resources we actually need so we can study and look at what those conversations are like and how can we be helpful. Like, where are the places where we can actually, I don't know if intervene is the right word here, but how do we use these stories and when people name what they're feeling so that it leads to actual betterment, right? Like better mental health and better just health outcomes in general. Oh,
So
I'm seeing more questions here.
Along those lines, Jose, as you watch the young people, and yourself included, who have been undocumented, are you noticing as they grow up that they are becoming physically ill? I ask the question because I strongly feel that what we call toxic stress later on in life results in diseases such as asthma, pulmonary disease, cardiology problems
Absolutely.
Go on, answer my.
Absolutely. But I'm curious though, I mean, I'm seeing this anecdotally for the past decade, all the undocumented people, especially the ones who are DACA eligible and kind of more the dreamer movement, right? And I've gotten to know their family, the kind of the family dynamics because of those friendships. But I've seen really a lot of how the stress of being undocumented, and for many of them who have shared their public status, how that actually leads to actual just health consequences, right? Diabetes, alcoholism, like a lot of just issues that frankly, because undocumented immigrants don't have access to healthcare in many parts of the country, right, are unaddressed, right? Like, and I wonder what kind of studies are actually being done in communities, for example, like I live here in the Bay Area where there's a pretty sizable undocumented population, but LA, New York, Houston, Miami. I'm curious what is the research that's out there so we can actually know again how we can help, right? Like what does that look like? And I'm really curious. I'm gonna put my my email address in the chat here if anybody have any kind of research to share, because I'm curious about the answer to that question myself.
Okay, thank you, Jose. So there are quite a few questions for you.
Yeah.
Stephanie De Cuba asks, what policy changes are you pushing for? How can we make concrete change?
Well, as I don't know if you know this, but Barbara knows this. So I used to be a political reporter at the Washington Post. So unfortunately, I know and I've reported how Congress works and doesn't work. I don't know what's going to come out of Congress beyond, for example, keeping DACA, right? So I myself, one of the reasons why I actually have enjoyed turning 40 is, how sometimes when they talk about dreamers, they talk about us like we're just a bunch of young people. Dreamers are now 40, right? We're not young, undocumented youth. We're just, middle-aged, right? And so stop infantilizing this issue and thinking of dreamers as like young people, right? I've heard from my sources that there is a chance that they would pass a DREAM Act where there's no age limit. So someone like me who have aged out of DACA, right? I'm 3 months too old for DACA, would actually qualify. But I tell you, I've met so many people, Barbara and her team at JPB know this, but we've met at Define Americans so many people who have aged out of DACA, who have not been a part of what's happened in the past almost decade now of DACA, which start to believe. Now, in terms of what's going to happen beyond that, I'm not optimistic about. And this is where I think less immigration reform coming out of the Hill, because we don't know what the likelihood of that is. I've actually come to the conclusion that a state by state approach is absolutely essential, right? A state by state approach. I don't know if you all know this, but most undocumented immigrants cannot drive legally in this country. There's only about 12 states that allow us to drive, right? Like it would be talk about lessening the stress, giving undocumented residents the ability to drive in states like Texas, right? Florida, right? Where there's a lot of undocumented immigrants and their families. That would lessen stress. So I would urge all of us to stop thinking about immigration reform as something that can happen out of Congress and something that can happen actually in your state and even your own local community, right? So think a little bit more local. Oh yeah, there's a lot of questions here. Should I just answer some of them? What do you suggest I do? Isabel, thank you, Isabel, by the way, this is more really of a statement here, that this is actually one of the things that we try to do at Define American is, it's Define American ? Right? Like we have to remember that all of this, North America, Central America, and South America, all of this are the Americas, right? I think that's really, really important. Okay. Oh, somebody asked about how important is the representation of the media and how do you, so Ariana Hernandez, thank you for that question. This is actually really why we exist as an organization, is tracking how immigrants are actually portrayed in the media. And as you all know, or if you don't know this, you can't really separate the 11 million undocumented population from the larger immigrant population, right? There are 45 million immigrants in this country, according to Pew. 11 million are undocumented. The reality is we all live in this, we all live together, right? Like within my own family, there are 34 of us who are here. 34 here in the Bay Area of Filipino Americans, right? Filipinos are the largest Asian group in California. There's 1.4 million of us in the state, right? So the reality is undocumented immigrants live within families with different status, and the way the media portrays us, and when I say the media, I actually mean the news media. So what you watch in the local news, right? And what you read in the New York Times or in the local newspaper or magazine. Entertainment media, the television shows and the films you watch and consume. And how digital media, how there's so much anti-immigrant xenophobic content on platforms like YouTube, for example. So that's actually where our work really exists, is how do we improve the representation of immigrants of all racial and ethnic backgrounds in the media? So please check us out and you'll see a lot more of our work when it comes to that. Okay, what else should I, there's quite a few now. Yes, undocumented immigrants are allowed to serve in the military. I can give a whole talk just on that, but we don't want to have a talk about the contradictory, hypocritical nature of immigration policy. That's a whole other, I feel like that's a whole other conversation. How do you measure resilience? That's a great question. And I actually think, I would argue that you can write, I would argue that you could measure American history through measuring resilience. I would argue that this is where I think actually you're seeing a lot of intersection between the movement for Black lives, right, and the immigrant rights movement and the LGBTQ movement. I don't know about you, but I feel like the past couple of months have been historic in AAPI history, right? As someone who's Filipino, I've never felt disconnected to other ethnicities that are a part of the AAPI movement than I have been in the past 2 months. And I feel like even watching what's happening with the AAPI community and how we're coming together is a form of resilience, right? I live here in the Bay Area, and some of the videos of the anti-Asian violence that you've been seeing a lot is actually happening here in the Bay Area. And here's the irony, right? San Francisco, a third of San Francisco is Asian. And yet so much of the footage that you're seeing of elderly Asian immigrants, Asian immigrants, right, being beaten are happening in San Francisco, which is a third Asian. What does that tell you about how deeply embedded the perpetual foreigner trope is about Asians in this country, right? So I actually think talking about resilience, now I don't know about measuring it, but I think as a way to connect our struggles as people who have been marginalized in this country, who are dealing with toxic stress in many ways, I think resilience is a way that connects us together. Should I just answer all these other questions?
So you can pick 1 or 2 more questions.
One or two more. Okay, what policy changes are you pushing for? I think I've already answered that. Can you describe the economic difficulties in undocumented immigrant women's face? I can describe it in a way that, because again, part of what we do at Divine American is collect stories, right? And we use these stories with the permission of the immigrants themselves to inform how we consult on entertainment media programs, like on television and movies. And we recently actually worked with undocumented women in LA, mostly Mexican, during the pandemic. And because we're working on a TV show that is trying to capture a lot of issues that immigrant women in particular face, right? And I can tell you that this is where I think disaggregating data is really important, because what is happening to just the Latinx community here in California during this pandemic is horrendous. And it's not only the economic difficulties, but really how that, as you know, funnel into economic and then mental health difficulties and the lack of resources and all of that. So my way of describing it is that we've collected these stories that's going to inform this television show, and it's really awful. It's really quite awful. And thankfully, it's in LA, so there are actually some resources available. But I wonder what's happening across the country in states like, where there aren't resources available, right? Because of how immigrants in general have been broadly criminalized. This question I don't have an answer to, but thanks for asking. Is there a known high resistance to COVID vaccination among undocumented people? Here in California, I haven't seen, thankfully here, I have family in the Central Valley, which is a big farming community here. I haven't seen resistance. I actually see a lot of enthusiasm in getting vaccination. But I wonder, again, this is where immigration as a local issue is really important, because I don't know what that's like in states that are not welcoming to immigrants and undocumented workers. So one last thing, yes, that I want to say before I leave you all is talk about hypocritical, right? So during this pandemic, we've talked about immigrant workers, many of whom are undocumented, as essential workers. And yet we have not necessarily thought of them as essential people. And I think that gets to the crux of this idea that we see immigrants as workers, as labor, right? High skilled labor, low skilled labor, the work that nobody else wants to do, right? And yet we don't really see them as people, which gets me back to the earlier point that I made. And that's why I'm so glad to have been invited to this, is I think part of seeing us as people is studying the impact of toxic stress and studying what mental health means to immigrants, regardless of immigration status. Mental health for many immigrants is not something that we talk about openly because we don't think we're allowed to. We think it's for, it's for those other people, right? And so I'm just grateful that as you all think of this day, that, that I was invited as speaker, but also that this is actually a part of the work that you do, because it's inclusive in that way.
Thank you, Jose. Thank you very much for bringing this very important problem facing our society to our attention. I also would like to thank all the speakers this morning for your contributions, and all of you who participate and listen with us. So, so this wrap up the morning program, and we will be back at 1:45. So I hope to see all of you.